Friends, once again I am presenting before you the new topic. I am Dr. Baldev Prajapati, Professor Emeritus and Director, Medical Education and Research, Baldev Medical College and Multi-Speciality Hospital, Kadi. Just to remind you, these are my 4 books. Please go through it. You will get lot many informations in pediatrics. And this is an institution which I am working at present. Today we are going to talk on seizures. Friends, you will agree with me, the seizures is the most common neurological emergency encountered in our pediatric practice. A proper and detailed history is an important tool for evaluation of a child with the seizures. If a clinician had an opportunity to observe the child during an episode or a video clip of the episode is available, it helps a lot for further evaluation. And therefore, if the parents have not captured an episode in video, you can advise them that they should do so whenever such an event recurs in the future. This is very important in the practice. Let us see how we define these this type of the conditions in neurology. Seizures is defined as a transient event resulting from abnormal, paroxysmal, excessive or synchronous electrical neuronal discharge, resulting in motor, sensory or autonomic disturbances. Please remember, seizures and convulsions are not synonymous, they are not same. Convulsion is a motor manifestation of seizures. That means convulsion is a subset or a type of seizures in which there is sudden, violent, irregular movements of the body. While spasms of the muscles is a quite different entity. Here there is the involuntary muscle contractions and therefore muscle spasms are evident. If I give the example, carpopedal spasms in a case of tetany, in hypocalcemia or even tetanus, here there is a spasms or involuntary contractions of the muscle. Here the child is totally conscious. So, that is the difference in seizures, convulsions and these spasms. Now, once I decide it is seizure, how it can be evaluated? First, always look at the age of the child. In neonate, most common causes are hypoglycemia, hypocalcemia, hypoxic ischemic encephalopathy, intracranial hemorrhage, inborn error of metabolism, CNS infections or CNS malformations. While febrile seizures are common in the age group of 6 months to 5 years, recurrent seizures, likely epilepsy, febrile seizures or in a case of inborn error of metabolism. Positive family history indicates some epileptic syndrome. Then go in the details of type of seizures. Suppose focal, likely some underlying structural lesion. Generalized tonic-clonic, absence seizures, myoclonic seizures, because they require the very different approach and even the management. Duration is also very important. Suppose typical febrile seizures is usually less than 10 minutes. But suppose if it is prolonged, then probably atypical, and then my prediction will be different. We know that nowadays status epilepticus is defined as 5 or more minutes time of either continuous seizure or repetitive seizures with no intervening recovery or the consciousness. That may be even the provoked or unprovoked seizures. Examples of provoked seizures are febrile seizure, bacterial meningitis, hypoglycemia, hypocalcemia, while unprovoked in a case of epilepsy, cerebral palsy. Even look for the neurocutaneous markers like capsular spot, shagreen patch, port wine stain, and these will suggest the neurocutaneous disorders. Look for injury marks over the forehead and even other parts of the body, which may indicate the myoclonic jerks. And then your approach will be quite different. Common causes of seizures in neonates, please remember hypoglycemia, never miss the estimation of blood glucose level in neonate seizures. Hypocalcemia, hypomagnesemia, hypoxic ischemic encephalopathy, bacterial meningitis, intracranial hemorrhage, in a case of particularly late hemorrhagic disease of newborn, CNS malformation, involved metabolism, and rare even paradox independency, but we should not miss it. Then common causes of seizures in children beyond the age of neonates. Please remember febrile seizure is the most common from 6 months to 5 years. Other regions may be the metabolic like hypoglycemia, hypocalcemia, magnesemia, hyponatremia, and even the hyponatremia. Yes, epilepsy is the major group. CNS infection is also common in this age group. Maybe due to the bacterial meningitis, tuberculous meningitis, viral encephalitis, maybe the brain abscess, or even the neurocystic sarcosis. Various encephalopathies are common in this age group. Maybe the Rett syndrome in infant, following enteric fever as a complication, enteric encephalopathy, hepatic encephalopathy. Sometimes nobody has measured to blood pressure and maybe the encephalopathy due to the hypertension, that is hypertension encephalopathy, maybe due to uremia or raised intracranial pressure in a case of hydrocephalus or space occupying lesion like brain tumor, tuberculoma, etc. Intracranial hemorrhage due to various reasons, neurocutaneous syndromes which I was talking with tuberous sclerosis, Sturge-Weber syndrome, neurofibromatosis, and so on. Inborn of metabolism and malformations are also common in this group. So, friends, these are the very common reasons for the seizures in children and neonates. Very simple, but very important, and I am sure it is going to be useful in the daily practice. Friends, I remind you to subscribe our channel, not to miss the further topics and more information. Thank you.